I'll go ahead and, okay, perfect. So folks, I am Dr. Roy. As many of you know, I am a natural medicine doctor, but I'm a fancy kind. What that means is I have both the conventional medical training and the training in natural therapies. My board specialty is in something called integrative oncology, which doesn't mean a lot here in Michigan. It's a very small field. There's only 75 of us in the US and Canada. And my job is to know and understand the interactions between natural therapies, nutrition, chemotherapy, radiation, and surgery in a cancer population. So you're fairly vulnerable, as many of you know, being out there in the world and struggling with a cancer diagnosis, because everybody has a cure, everybody has something natural for cancer. And my job is to help you to navigate that and avoid taking natural therapies that can conflict with your conventional management. Make sure that we help to prevent and treat side effects from treatment and optimize outcomes in survivorship or supportive care. So supportive care is a big umbrella, and there's a lot of pieces to that, a lot of pieces to what that looks like. Today, we're talking about sex, sexuality, intimacy, and cancer. And I see a lot of people have named themselves a fruit, which I really appreciate. It's super sweet to see. And I'm going to use a slide now, or a PowerPoint now. I'm going to share my screen and put this up for you guys. And let's see. Can you guys see my PowerPoint here? Megan, thank you. Yeah. Maybe I could make it a little bit, that's not what I wanted. Let me make it a little bit more viewable. Give me one moment, guys. I haven't done this without my IT person next to me in a long time. Okay. So today we're gonna, as I talked about, no open Q&A. I just want to just briefly mention gender pronouns. Megan, this is easy to view, right? This slide. I want to just mention gender pronouns. I'm not great at them, so I hope I don't offend anybody. I am going to use the word partner when I'm talking about the person that you choose to be intimate with, although that may not, you may not have a partner, and that's just fine. This talk is as applicable to men as it is to women, because we are going to be going over the changes that happen in both men and women with cancer diagnosis. And it's a good talk for caretakers, so don't kick them out of the room, even if you're embarrassed. Or if you are embarrassed, let them listen to the recording later. Okay. So the first thing I want to talk about here is, why aren't we talking about sex? And part of it is that there's a misunderstanding about what intimacy is. It doesn't have to be with another person, and it isn't always or even often about intercourse. And I think those two misconceptions are one of the reasons why we don't talk about it. And I'm talking about sex when we've been diagnosed with cancer. Another reason is us as docs may be uncomfortable when we talk about sex or take a sex history. We may be bringing our own baggage to the conversation and have our own insecurities about talking to you about sex. And we may also be not that knowledgeable about what we can do about sexual issues that can come up during treatment. While we're very knowledgeable on treatment, we may not be as knowledgeable on the supportive care pieces. So just a couple of notes here. I want you to identify one person that you are comfortable talking with. It doesn't have to be your doctor. It could be your nurse. It could be your social worker. It could be your therapist. It could be someone like myself. But think about people that you are comfortable talking with, and identify who that person is for you. Also, being a cancer patient, and you guys all know this, and I know many of you struggle with the frustration of this, you often have to be your own advocate. And that means that the more questions you do ask us, the more we learn about what we need to know to support you. So part of what you're doing in asking us these difficult questions, even though we may be uncomfortable, is helping us to educate ourselves on helping you and other people. So in a way, you're paying it forward. I like to call you health soldiers, because you are so often your own advocate and paving the way for other people. And the last reason, obviously, is you could be uncomfortable. When we're diagnosed with cancer, we often feel like, oh, my life is on the line. How dare I be thinking about something as unimportant as sex? There's such a thing as necessary losses. So oftentimes people tell us, or we ourselves feel like, we have to give up our hair, our eyebrows, our marriages, our financial stability, our control, because we're trying to fight for our lives. And so we treat those as necessary losses in that battle. And we deprioritize things like our sexual health. And another reason it may not be a priority to you. So I hope to not change your minds, but maybe spark your curiosity and your interest in why it is important for you, whether you have a partner or not. And the reason why is that sexual health is one of the best ways of looking at health truly holistically. And towards the end of this talk, I'm going to really bring it home with a case. But I think what I would say right now is that sexual health is our total health because it has biological features, it has psychological features, and it has social features. So when we're good or we're healthy in terms of our sexuality and our intimacy, whether it's with ourselves or others, we tend to be manifesting health in other areas of our life. And I'm going to go into more detail there. So having good sexual health also helps us to reframe our identity. One of the things that I think we struggle with a cancer diagnosis is, who am I now? If I'm missing my erectile function, if I'm not able to please my partner, if I don't have my uterus, my ovaries, my breasts, my hair, how do I identify myself as a woman, as a man, as a human being, as a citizen in society? What does it mean to be me? And so reframing and working on our sexuality and our sexual identity helps us to rediscover and kind of reframe who we are in the context of our relationships. Sexual health is one of the most important pieces of it is empowerment and connection. So that's really the marrow of life, right, folks? When we face the fear of dying and when we hear this diagnosis and we go through the stress and the strain, what are we really fighting for? Sure, we're fighting for our lives, but what does life mean? We're fighting for that connection to others. We're fighting for that feeling of empowerment, of manifesting the self. And sexuality and sexual intimacy is one of the most powerful ways that we can do that. I like to crib from Václav Havel, who was an Eastern European pioneer in public health. And he once said, good health is a human right. I think oftentimes as cancer patients, we kind of give up a lot in terms of what we consider our rights as a patient, because we do feel like our lives are on the line. But good health is your right. The NCCN is the National Comprehensive Cancer Network. And this is sort of the organization where that kind of organizes the guidelines for cancer care. So approximately 27 centers come together and design the protocols for cancer care. And then the government kind of rubber stamps those and they get put together in a document that helps doctors decide how they're going to treat you. And one of the things that we're not really good at in cancer care is there are very specific guidelines around supportive care, which is our job as integrative oncologists. And those guidelines mean that we need to be really skilled in all of these pieces that you see here, including toxicities and survivorship. And a piece of survivorship is sexual function. So you may feel like, oh, I don't want to be the only person bringing this up. But the reality is that it is well documented that sexual function and good sexual function is a part of survivorship, which begins from the moment of diagnosis through the entirety of your life. And it's not something that we should ignore as doctors. It's just something that we don't think a lot about. Now, again, as a reminder, a lot of you are my patients, some of you are not. In our clinic, these are our job and this is our specialty. So I don't want you to feel defeated if you're not getting that with your oncologist. Just talk to them about seeing us. I would say 70% of our referrals are, or 70% of our patients are direct referral from oncology. which means that Michigan is progressive. So what are we going to cover today? I know you guys probably have really specific questions. I'm sorry that we're not able to do a Q&A. It's such a sensitive topic. I don't want to risk alienating or embarrassing anybody. So I am going to do vaginal health overall, erectile function overall, sensation changes. So the big umbrella concerns. We'll go over some resources and a case study. And I'm going to go through a list now of things that can go wrong. I'm going to go slowly, and I'd like for you to just put in the chat the number of the ones that are most important to you. And if we have time at the end, I'll kind of go back and focus more on those. Okay, so what goes wrong? How can a cancer diagnosis impact our physiology and our biology? So we could have decreased desire, vaginal dryness due to surgical or medical menopause, erectile function difficulties, loss of sensation that includes taste. So taste is a part of our sexual experience, nerve function, which can result in difficulty to orgasm. You may have heard from other speakers or other seminars that you've attended that if you can masturbate yourself to orgasm, then everything works. That's not necessarily the case when you've been diagnosed with cancer, because there are things that can interfere with orgasm. You could have pain rectally or vaginally or orally with penetration. And again, I'm not excluding anybody here or any type of sex, and we'll talk about that in a minute. You could have structural changes to your rectum, your genitals, and other what are considered erogenous areas. Erogenous are areas of the body that are considered typically really sensitive to sexual stimulation. You could have concerns about your body image, less energy, low counts, so fear of bleeding and infection, anxiety, depression, a sense of hopelessness, and everybody knows who wants to have sex when we have depression. Oh, you guys, I really wanted to play that Salt and Pepper song, Let's Talk About Sex, Baby, when Megan was letting people in, but I totally forgot to make this a little more fun than it is right now. Maybe my IT person, Kasim, could pull that song up and play it at the end. Changes in vaginal odor or discharge, urinary or fecal incontinence or anostomy. So those are biological and physiological reasons why a cancer diagnosis may interfere with sexuality and intimacy. Psychological could be fear. Is it safe for me to have sex? Will I hurt my partner? Will it hurt me? And feeling rejected or afraid of being rejected because your body has changed. Stress with planning, appointment logistics. Who here struggles with the amount of appointments you have to make, including to see me? Caretaking, so caretaking stress. I think I just want to make a note here. If you are a caretaker and you're in this group today, it's really important to have support outside of your partner to talk about everything, including the things that scare you, the things that gross you out, the things that you're afraid of, because this isn't the place to talk about it, is with your partner. And I'm seeing my practice manager is putting up a white form on the chat there. That form, if you click on it, it says HTTPS HIPAA jot form. You can put in your name and your email address, and that will allow us to invite you to other talks that we do. We do a lot of free education. Kasim, every time the title is yellow is when I wanted you to post that, and I forgot to tell you that. And I don't know how to get rid of that chat now. Shoot, give me 1 second, folks. Maybe I can't get rid of it while I'm in this. Oh, there we go. So stress with planning appointments. What about social things? So social culturally, we may have limited health education around sexuality. You may feel pressure to have sex regardless. For example, you may belong to a culture like Asian cultures or African cultures where you have sex with your husband regardless of your circumstances. You may be culturally conditioned to not talk about sex, or culturally conditioned not to admit that you have a problem. For example, in a lot of cultures, and particularly among men, it may not be something that you want to discuss, not being able to have good erectile function, or performance pressure for either men or women. And you may have been told by your doctor or your friends or your family not to have sex. And I hope to really clarify that today. Okay, so let's get the safety part out of the way first. You have to be careful about pregnancy. If you are premenopausal and you have your ovaries in your uterus, you may become pregnant. If you are male, you can impregnate somebody. So you want to be really cautious, because you don't want to be in a situation where you have a pregnancy during treatment, because you may need to consider termination, because that pregnancy can be impacted by the drugs that you're exposed to, and we hate to see anybody in that situation. Exposure to chemotherapy. So if you're with us or you're planning on seeing us, we do prepare you for chemotherapy with a preparation class in which we talk about this in depth. But just briefly, if you're taking cancer drugs, you can be excreting them in your urine, your poop, and your saliva, sometimes sweat. So it's really important to be cautious in terms of the bathroom that you're using. And I don't want to go too far into that, because we do that with our patients, and I'd rather you just reach out to us directly. But what I will say is, if you are going to have sex, it's best to wait 72 hours after infusion and to be using a barrier method. So that would be a condom or a dental dam if you're having oral sex, oral to genital. And if you're having anal sex, to wait a week after infusion if you're comfortable with that, okay? And still use a barrier method. Pain. So if you're in pain, and I know that for many people, pain may be part of their pleasure. In this case, with a cancer diagnosis, if you're in pain, don't do it. You just don't want to take a risk there that you're hurting yourself or hurting your partner in a way that might cause some health problems. And low counts. All of you know what neutrophils and platelets are. So if your platelets are below an 80, you usually don't even get treatment, but you're also more prone to bleeding, even if they're under 100 or 120. So you want to be aware, at least, that you may have some bleeding with intercourse if you're choosing to have intercourse. And you may want to be cautious if your neutrophils are low, if they're under 1, especially with a partner that's unknown to you, you are at greater risk of infections. Okay. And we're going to talk about pH in a minute, but I want to throw in here that you also are more prone to a dysbiosis. So we all have this flora and fauna, almost like a jungle that's living in our genitalia and regulating things. They're regulating the bacterial environment. They're regulating metabolic action. They're regulating all sorts of things, even mood in our GI and GU system. And we want to make sure when we're going through cancer treatment that we understand that flora and fauna can be imbalanced. And when it is, we can have an overgrowth of certain kinds of critters, and we can have an undergrowth of other kinds of critters. And when that happens, that makes us more susceptible to irritations, like it could be a candidiasis, like a yeast infection, or a dermatitis, or even just feeling off, or a bacterial vaginosis. And we'll talk about that in just a minute. So let's talk about solutions, because who cares about the bad stuff, right? Let's talk about what we do about this, right? So I'm going to get really specific here, and you're totally welcome to take notes. But again, we are recording. This will go up on YouTube pretty soon. So you can also rewatch it over and over again. Lubricants are necessary. I know people don't love them, especially if you haven't had to use them in the past. But when you have a cancer diagnosis and or you're in survivorship, or you finish treatment and you're in survivorship, you must use lubricants. You want to avoid lubricants that are scented, have glycerin in them. Glycerin is put in lubricants to make it more smooth, so it has more of a glide to it. But glycerin is a sugar, and so it can increase the problems with the dysbiosis that we talked about before. Flavorings, you want to avoid flavoring in a lubricant because they can have sugar in it, which can increase the dysbiosis there. Petroleum products, because they upregulate estrogen a little bit, and they also can change the pH of the vagina or the rectum or the buccal cavity, whatever you're using in terms of penetration. And you want to avoid sensation inducing lubricants. Those are ones that like heat up. For example, they might have a little chemical in them that makes them heat up to the touch. So these are good lubricants for you. Pejor, Sliquid, Almost Naked, coconut oil. KY does have a water-based formula, and Sustain. You guys may have ones that you really like, and you're welcome to throw those in the chat to everyone if you would prefer. I would just say about coconut oil is excellent as a lubricant, but it gets dry with intercourse. So you may want to just use it for foreplay and as a vulva vaginal or a massage or a penis massage. Vaginal moisturizer. So we're just talking about vulva vaginal health now, and then we'll talk about penis health in just a minute. I hate saying penile, but so I might say penis instead of penile. Vaginal moisturizers. So there was a question just now in the chat, how often to use them. So Replens and Reverie are the ones that we usually recommend. Reverie is not as well known as Replens, and Replens is pretty well established, has good data behind it. Reverie is hyaluronic acid. It also works. It's not an acid technically. It's technically a molecule that sucks up water and brings it into the vagina to keep it nice and moist. I like to see people start out with 2 times a week, but you can go up to 4 times a week for vaginal moisturizers. And you should be using those in addition to lubricants. It's really, really important, people. You want to mimic a normal, healthy, moist, and happy vagina as much as you can, okay? So estrogen, topical estrogen or estriol is a really hotly debated topic among PCPs and gynecologists, but it's not for us because I think we understand estrogen a little bit differently. If worse comes to worse and we really need it, a low dose estriol topical once or twice a week, a tiny little smear on the inside of the thigh can be very useful for people who really don't get any relief. It's conjugated differently than other kinds of estrogen, so it's not likely to raise serum or blood levels of estrogen enough to increase risk of recurrence with reproductive and breast cancers. And I just put some data in here. It's not important for you to look up these studies, but there are some oncologists in the group today who are progressively and wonderfully choosing to get educated as well. And so I wanted them to be able to access that data. Okay. And I appreciate the questions that are coming in the chat. I'll try to get to them, but I may also cover them as I talk. So other solutions about vulvovaginal changes. So you must use the vagina. And I think one of the harder parts about being diagnosed with cancer is we tend to disassociate from our bodies, almost like feel like our body has betrayed us and like push it away, something we don't want to talk about, we don't want to think about. The problem with doing that is the vagina can actually develop adhesions. It can become hard to penetrate. So you need to introduce penetration to tolerance. And that could just be a dilator. It could be a lubricated finger, or we could work with a pelvic floor therapist on different ways to do that. Increased time for cuddling. So I never knew what this word meant, and it was interesting to me to see it in the research. But you guys may know, cuddling is really just like loving touch and can include sexual touch. Really increasing the length of time before penetration is important. So partners who are on this talk today, women are all about 2 things. They're about getting in your head and about the length of foreplay. So getting in her head means talking to her, really making her feel trusted and listened to, and extending the time to which you are touching her or interacting with her before you try to introduce penetration. Masturbation. So if you don't have a partner, that's just fine. This talk is also for you. You really do want to use your vagina as much as you can so that it stays nice and elastic and responsive. To preserve elasticity and avoid adhesions, you can use a dildo or a dilator. Dilators they look like dildos. Dildos are in the shape of a penis, but without the vibrating portion of that. And a dilator is a progressively larger dildo, but it's a medical thing and it comes in a little kit. And your gynonc or your gynecologist or your medonc can talk to you about dilators if necessary. Massage, both perineal and vulvovaginal, is really important. The perineum is the part between the vagina and the rectum or the anus. And we're going to talk about this later on when we look at a picture. You guys may remember, ladies who are reading about right now, paying attention to the vulvovaginal part, you may remember when you were pregnant, your doctor or your midwife talking to you about doing perianal massage to keep that tissue nice and elastic. What would you massage with? Coconut oil, olive oil, although it smells a little bit. Almond oil is a good carrier oil, and you can add castor oil or vitamin E oil to that. Okay. Pelvic floor therapy. Beaumont has an excellent pelvic health center. Actually, it's devoted entirely to this. Your insurance covers it. They have great pelvic floor therapists there. And then this website, pelvicgym.co, not com, I don't know why, but .co, is a 3-week program that you can do yourself online in the privacy of your home to help you to restore functioning to the pelvic floor muscles. And again, I'm going to show you a picture, but the pelvic floor is really a basket. It's like a really interknit basket of muscles. And if we picture the rectum here and the vagina here, we're talking about muscles that can get stuck, can get stiff, can become adhesive, can develop adhesions and get stuck together. So pelvic floor therapy helps to improve the muscular tone, just like you would get physical therapy for your shoulder, helps to improve the physical tone of those muscles, and also can help with incontinence, urinary and fecal incontinence, and with orgasm, actually, believe it or not. I just wanted to highlight this data because I talk about it with my patients all the time. There's a really excellent study that looked at vaginal dryness in postmenopausal women, and it showed that using olive oil or coconut oil or some sort of oil like that and doing a vulvovaginal massage after bathing over a 12-week period reduced the risk of vaginal dryness by over 30%. So it's not something that you have in your kitchen that you open the kitchen cabinet for and then take it to the bathroom. Have your own one for the bathroom, use it in a push pump that you can push it right onto your hand. And vulvovaginal, remember, the vagina is the outside of the organ. The vulva is the outside of the organ, the vagina is the inside of the organ. So just 2.5 inches, right, like to here, it would be a vulvovaginal massage, just like you're putting lotion on your hands. Okay, don't be scared of your vagina. Megan, I hope you're listening because your face is super still. You know, I can't see anybody, so you're my only audience here. Okay, thank you, dear. All right, let's talk about erectile function issues. And I appreciate all the smiles and the big ups that I'm getting. And the compliments on here. Oh, somebody said I look fabulous. I meant to address that. I actually don't normally look fabulous. So I'm going to tell you a quick story before we move on to erectile function. Even though I'm well into my career by this point, and I do a ton of public speaking, when I first started out, I had a big talk at Michigan Institute of Urology with the head of that institute who had invited me as a guest speaker. And I locked myself out of my house and I was wearing my pajamas. And this talk was going to be televised for a public access channel. So I got it together. I took some clothes out of my trunk. I put them on. I ran my fingers through my hair and I went to this talk. Years later, my family in Africa found it on YouTube, and it has become the butt of many, many jokes for many, many years. So I'm always trying to get it together for these talks and find the right look for YouTube. But actually in our practice, we don't wear our hair down. We don't wear makeup. It's part of our policy to be as plain as possible, not because we're trying to look down, but really because we don't want you to be triggered in any way. And we like for our patients to come in and feel like we're right there with them. So this is unusual for me, which is why patients keep chatting about it. Okay, so let's talk about erectile issues. So solutions for erectile issues. And when we're talking about erectile issues, we could be talking about mostly erectile dysfunction. So when we're talking about a sex history with our patients, which we do for every new patient, and we often check in on it, a sex history for us looks like the following. Do you feel safe and supported in your partnership, if they have a partnership? Can you tell me how often are you intimate? How often do you have intercourse? And then we differentiate between the two of those. If we are talking about intercourse, we might say, any problems in getting and maintaining an erection over the last 6 months? Which is it, getting or maintaining? And then we'll talk about ejaculation, any discomfort there. With women, very similar. Obviously, we're not talking about erectile function, but we'll talk about pain and discomfort on entrance and on intercourse, because it's different in terms of what we decide to do. But we're very, we talk really explicitly about it because it's a big part of your life. And I'm going to talk more about that in a minute. So here we're talking mostly about erectile dysfunction, but we could also be talking about discomfort with ejaculation or urinary incontinence. So solutions, constriction rings. So I just put this word here because most people don't know what a constriction ring is, but they may have heard of this type of ring. It's a ring that fits around the base of the penis. And there are rings that have a ring around the base and a ring around just below the head of the penis where there's an attachment. And so it kind of holds it more erect. So you just want to get on your faithful Google and look for what you're looking for. Okay. Vacuum devices. Vacuum devices are really, really important. The earlier intervention for erectile function post prostate cancer surgery, the better your erectile function is going to be. And I even mean early, like before you even get the surgery. But vacuum devices just really just stimulate blood flow, because when we're talking about erectile function, we're talking about nerve function. What feeds the nerves? Blood vessels. Blood vessels are bringing nutrients to those nerves so that we can have that nice, robust erection. Vacuum devices are a way of kind of bringing vascular flow to that organ so that we can regenerate those nerves and nourish them. And again, I don't want you to think this is like funny or embarrassing or something that you want to hide. These are things that really should be standard of care, part of how we talk about life, because we want to have that good function. And if we dismiss it or we hide from it or we avoid it, we tend to get away from the time period where we can regenerate that nerve function. O-nut. So O-nut are these really soft rings that can be placed on the base of the penis, and they go up in size. And the website is onut.co, not com, .co, and they help to lengthen the depth of penetration. So if your partner is struggling with the depth of penetration with your penis and you really want to still have that same type of pleasure, O-nut is a wonderful device for that. And you can combine O-nut with positioning so that you can alter or play with penetration and really get to a place where you're comfortable. PDE5 inhibitors, so everybody's heard of these, Viagra, Cialis. You want to talk to your med-onc or your urologist about them. We find that there's good data that starting them early, even before surgery, can help with erectile function post-surgery. And a 5 milligram dose combined with natural therapies and supportive care can be ideal for a man in recovering erectile function. Penile prosthesis. This may sound really aggressive, but in fact, these surgeries are really effective, and they involve an implant that goes into the penis with a bulb device that's under the skin. You can't see it. However, it does require a surgery with general anesthesia, so people don't love to do it, meaning patients don't love to do it, but it is very effective. I just put a website here that I thought was really helpful in explaining it. And again, this talk will go up, so don't feel like you need to write furiously. Solutions for erectile issues continued. So pelvic floor physical therapy, we just talked about it for women, super, super important for men as well. You guys may have known of Kegel exercises where you kind of, and I want all of you to do this right now, especially you, Megan, you kind of close your eyes and then picture your vagina, rectum, or penis picking up a peach and sucking on it. And so that kind of squeezing action is called a Kegel. What you're doing is you're strengthening that pelvic floor. Combining Kegel or Kegel exercises along with physical therapy is very effective for improving men's erectile function. Injection therapy, nobody likes to give themselves injections. They're very effective for many people, however. So it's something to consider, and it's something to talk to your med-onc or your urologist about. Phoenix Pro Therapy, this is a very new thing. It's basically a vibrator, but it's a very strong one that is applied to the outside of the penis and the scrotum. And it introduces like a lot of stimulation, almost like micro shocks that can bring blood flow to the area and regenerate the nerves. It's got pretty good data. My medical supervisor is Joel Kahn. I just put his website here because he talks a lot about it, because he talks a lot about erectile function. He does have it at his office, and it's something that you can buy and do at home. You don't need to be doing it in a doctor's office. Natural therapies. Wow, did I skip natural therapies for vulvovaginal health? Let me just go back here and see if I did. Wow, I did. I'm so sad about that. I'll go back to it at the end, but natural therapies for erectile function, fish oil, low dose glutamine, B vitamins, not including iron and folic acid, magnesium glycinate, lifestyle changes and exercise are really important for improving erectile function. Just as an example, B vitamins are nerve supportive, or magnesium glycinate actually is a vasodilator. So it brings more blood flow to the organ. So these are super important. CI means there can be contraindications with that person's particular history, makeup, and treatment trajectory. So it's not something you can just pick up over the counter, and I'm going to talk about that a little bit later. It is something you need to talk to us about. Perianal massage, as we just talked about, rectal massage, prostate stimulation, again, talk to your urologist about it, but all of those things can help to increase the quality of erectile function. I'm talking really fast because I have a lot of things I want to go over. So I'm just going to pause for a second. Check my time here. Where are we at on time, Megan? I don't see a time here. I don't have my phone. Oh, well. Let me go back here to vulvovaginal health and natural therapies. So there are some essential natural therapies for vulvovaginal health. Fish oil, which again can be contraindicated. Probiotics. Probiotics are not well regulated. No supplements are well regulated over the counter. So we only prescribe pharmaceutical grade probiotics. Pharmaceutical grade probiotics help to, thank you so much, Megan, help to correct the bacterial flora and fauna that live in the vagina and help to avoid those kinds of dysbioses we were talking about. We formulate in our medical dispensary hormone balancing teas that are individualized to our patients. Those are very helpful in managing medical and surgical menopause and the side effects, including vaginal dryness, that are associated with that. Nutrition, so fermented foods, anti-inflammatory foods, phytoestrogens. So phytoestrogens are really, thank you, David, are a really terrible term because it sounds like we're giving you estrogens, but lentils and beans are examples of phytoestrogens. Those are foods that shift Estrogen is kind of an umbrella term for 16 chemicals, some of which are more cancer promoting, some of which are cancer protective. Phytoestrogens like lentils and beans, 2 portions a day of whole foods, help to not only lower your risk of recurrence, but also shift or modulate estrogen production. DHA is a consideration for some of my patients, but really important to pH balance with, and sometimes we do that with suppositories. Somebody just asked me, do you insert probiotics vaginally or do you take them orally? We don't insert them vaginally. We do prescribe them orally, but we use specially formulated, medicinally formulated suppositories sometimes to locally correct a dysbiosis. So those would be suppositories that we would specifically prescribe for you. Lifestyle changes that I'm not going to go into really in depth right now. Sit spas. Those are the little baths that you put on your toilet seat so you can sit like and soak your vagina and your perianal area. And you can do that with calendula, baking soda, vinegar. All of these things we have obviously as part of what we do to support patients and nutrition changes. So I'm seeing by my clock that I have 15 minutes before technically we're done. We're not going to be done at 5. So sorry, Megan. We're going to go over a little bit, but I think this information is so important that I really want to get all of it to you. Is that okay, Megan? Thank you. Okay. So back to solutions for erectile issues. The penis is actually more complicated than the vagina, would you believe? And the reason why it's more complicated is it's an organ that also is closely connected to the health of your other organs. For example, if you have poor erectile function before you start treatment, it can be an indication of upstream poor cardiac health. So the penis has all these little tiny vessels in it. And if those are problematic, then it could be that the pump has a problem upstream. It's really important for us in our clinic that we do as much prevention by addressing cardiac and metabolic issues like sugar issues, for example, before we have to move forward with treatment. So especially if a patient is in active surveillance or watchful waiting, we want to use that time to be really aggressive about improving cardiac and metabolic health. Why? Because good erectile function is a good prognostic factor for having good erectile function following treatment. The skill of the surgeon matters, nerve sparing techniques matter. There's basically 2 nerve bundles that feed the penis, and you want to make sure that you can spare at least one of them. As I talked about, early aggressive intervention, and don't give up. Guys tend to give up so much sooner than women do, so don't give up. Change is inevitable in life for all of us. Our bodies change. That's part of life. I don't want you to get into this sort of pathology of like, I'm a cancer patient and therefore I'm somehow disabled or deformed. The reality is all our bodies change, whether just because of living on this earth, just because of aging, because of accidents, because of childbirth, because of all sorts of things. So change is inevitable. We just have to learn how to adapt. People who are successful adapt to change rather than fighting it. Also, I want to remind my guys, women experience sexual pleasure more frequently without penetration, so get good at other stuff. And we're going to talk about that in a minute. Oral sex, manual sex, using toys like hollow strap-ons. They're a type of toy which looks like a penis and it's got a closed end, so you kind of wear it as a belt, but a penis that's not erect can go in a hollow strap-on. Verbal stimulation, so talking to her about what you love, what you want to do, what turns you on. Sensual touch and self-stimulation is all sex. Okay. Essential support for vascular support following prostate surgery: citrulline, which gets converted to arginine, resveratrol, ashwagandha, pomegranate, And again, if you're our patient, we'll talk through these in more detail. All I want you to remember is there's a lot of natural therapies that help to improve vascular flow and support nerves. And there's a lot of overlap. Some of these are appropriate for women, or most of these are appropriate for women, and most of the supportive care for women is appropriate for men. Okay. Are there herbs that help? Yes, but as I mentioned, supplements are not well regulated in this country. So I do not want you buying things over the counter. I didn't put this in the chat, but I do want to mention, Kasim, just remember when you see a yellow title, that's when you're putting up that jot form. And folks, when you see that jot form in the chat, I want you to click on it and fill it out for me. I really like to know everybody that I talk to, and I don't need to know you in person, but I need to know that you know when I'm speaking again. So supplements, again, are not well regulated. I want you to go to Be Well with AIM, and just because you're in this talk, I'm going to give you a password to use, which is AIM, in order to get pharmaceutical grade supplements, or come see us. If we do put supplements together to increase vulvovaginal stimulation or erectile stimulation, we usually do them as a tea. We're cautious about interactions, and we formulate those specially for you. Somebody's mentioning that there seems to be more resources for men than there are for women. Again, my friend, there's a lot of overlap here. So it's not that there's more resources. It may be just how I spaced out the slides. Go through them later at your leisure, and you'll see that they're really comprehensive and there's a lot of overlap. If you take nothing away at all, it should be that there's so much we can do. Right? This is a picture of a person who's lying on their back. This would be the anus. This would be the scrotum here in the testicles. So the penis has been pulled up. This is the perianal area. So it's the area between the anus and the scrotum on a man, or the anus and the vagina on a woman. And this is what the pelvic floor looks like. So as you can see, there's a lot of muscles that connect here, both large ones and small ones. And then look at how nerve dense this basket is. Again, there's a basket of nerves that encircle it. And if you see a nerve in real life, when you're looking at a person, you're also going to see a vessel that runs right alongside it. So really well vascularized, really nerve dense area. Okay, so massage of this area and stimulation can be really important with vibration. So this person is saying to me, not my presentation's not heavy in men, just practitioners tend to be heavy in men. I hear you, but there's also, like we talked about in the beginning, we have to be our own advocates when we're talking with med-oncs. And as I mentioned, there's some gyn-oncs on the talk today. So they are really interested in learning about sexual health and sexuality with their patients. The problem is really, as we talked about, people are uncomfortable talking about it because they may not know. Let's talk about sensation changes. So sensation changes have to do with nerve function, taste, sight, hearing. So when we're talking about sensation, we're talking about our sensations, right? Sexual aids for sensation could be paddles, feathers. Wartenberg wheel is like kind of a wheel that you run across your skin. Audio erotica, so listening to someone tell a story that's particularly erotic to you. Essential oils, so lavender, for example, is stimulating. Rose is stimulating. Citrus oils are stimulating, or flavors if you can tolerate them. And I don't mean in your lubricant, right? But I mean maybe putting flavors on your fingers like chocolate, so on and so forth. Think about your sensations not just being what you feel generally, but your sight, your smell, your taste, what you hear. Really start to engage all of those other things, people. You guys can become sexual connoisseurs and sexual whizzes. You don't need to be kind of restricted to this one way of looking at intimacy. Vibrators are super important. They're actually really effective. Everybody should own one, especially if we're working on intimacy, because they improve vascular flow and they don't need to be used internally. They can be used externally. That Phoenician Pro that I talked about for erectile function that Dr. Khan has in his office, or that you can order and use at home, is essentially a vibrator, just a really high powered one. And what it does is improve vascular flow. Sensation changes. So porn, a lot of people are really uncomfortable with porn, especially women, because we may associate it with feeling dehumanized or excluded or humiliated in some way. These are just really good websites that are female friendly. YouPorn, Bellesa, Porn 300, and Literotica is stories, erotic stories, which sometimes can be easier for women. And you guys may know more than I do about porn that is female friendly. And for my guys, I know that that may be sort of women centric to say female friendly for porn, but you want to really recruit your partner. And it's hard to recruit your partner if they're feeling frightened or disturbed or offended. Okay. There's no bigger turnoff sometimes. And sometimes you might get off on that. This meditation should have been a point here. It got moved over, and I'm sad about that because meditation is very important for helping you to work around your sensations. Mindfulness and MBSR. So mindfulness is about being in this moment right now. So if all of us could just close our eyes for a minute, and Megan's going to be my guinea pig, we're going to close our eyes for a minute, and I just want you to notice, what are you hearing? What does it smell like? What does it feel like? What does your butt feel like in that chair? How does your stomach feel? How does your chest feel? How's your back feel? Any pain anywhere? What does it taste like? Is your mouth dry? Is your mouth tacky? Is it sour? Let's open our eyes. That's what mindfulness is. Mindfulness is a way of constantly bringing yourself back to that moment. And I'm sure Megan, if she could unmute herself and talk, would say that she felt actually a little more peace and a little more present. And we're so used to tuning out the moment that we're in and looking to the future, which is a really strange way to live, but it is how we've learned to live. The therapists that work with our practice are trained in mindfulness-based stress reduction. Mindfulness is very helpful for sensation changes. Sensory deprivation. So if there's a sensation that you're trying to enhance, blindfolding or using earplugs can help you to feel that other sensation. Like if you're blindfolded, then you hear things more acutely, for example, or you taste them more acutely. So those are techniques that you can include and play with, get really creative with it. Guided visualization. So healthjourneys.com has two guided visualizations I really like, sexual healing and sexual intimacy. I think those are really helpful in helping recruit your mind to what you're trying to do. But I also like healing trauma for you guys. And the reason I like healing trauma, and believe me, I do these guided visualizations as well, is because I think there's so much trauma that can happen with a cancer diagnosis and with cancer treatment, just in getting constant physical exams, being poked and prodded, being looked at by people you don't know, having to disrobe. You can often just not feel like a sexual person at all. And I think part of that is processing some of that trauma. And good ways to do that and gentle ways to do that are through guided visualizations. And play with positioning. So legs together, for example, being on your side. Don't worry about having lazy sex. You don't need to perform. If you just want to lie there, that's okay. At least you're trying at intimacy. Playing with positioning can help you to try and find places that are more erogenous for you. Maybe you didn't know it, but the back of your knees are an erogenous zone. Maybe you didn't know it, but the back of your neck is an erogenous zone for you. Okay, so I'm going to skip through these resources because God knows I'm not reading these to you, and they're on here so that people can go back and use this as a resource. I just want to point out that there's a lot of resources on here that contain everything from how to buy a thong when you have a stoma to resources for our LGBTQI community. And then these are books that I think are really helpful, but we have a complete reading list at AIM. This is just a couple that I like. I want to highlight that one book that's really important to me, and I feel like it's going to be really important to you. And I just want to prepare you that you're going to be surprised by the title, and that is The Whole Lesbian Sex Book. So I love this book for patients, my cancer patients. And the reason why is it's written by Felice Newman. Felice Newman is an extraordinary sex educator. And the lesbian community tends to be really focused on non-penetrative sex. So the lesbian community is really focused on communication and alternative ways of experiencing intimacy. This book goes chapter by chapter for different kinds of intimacy. So it starts with, let's say, oral intimacy, and it talks to you, it has a whole chapter that's written beautifully about how to talk to your partner about oral sex, how to start with oral sex, how to experiment with oral sex, and then so on and so forth. Manual stimulation, anal stimulation, sensory stimulation, and so on and so forth. You can tear off the front cover if you're too embarrassed to have it in your house, or you can even get an audiobook, although I think the book itself is really helpful because it has pictures. But this book is the best guide I've ever seen for non-penetrative sex and alternative ways to experience intimacy, not just with others, but with yourself. Intimacy without intercourse. So we have a comprehensive list at Associates of Integrative Medicine. I'm just going to tell you about a couple that I think are important. Soul gazing means just staring in someone's eyes. So looking at them and really holding their eye contact. You'd be surprised at how intense that can be. Megan's going to try and do it with me right now. We're going to stare in each other's eyes. It's really intense. And if we were sitting across from each other, we'd start to have all these feelings come up. Another exercise we could do is touching our foreheads to each other and aligning our breath so we're breathing in and out at the same time. Make sure you brush your teeth first. I know some of these are hard during COVID, and I just want to highlight one more: Rogerian listening. Rogerian listening means truly listening to another person and then reframing what they said with unconditional positive regard. This may sound crazy, but that could be the biggest turn on for many people, mostly women, but many people. You'd be surprised. You'd be surprised at how shocked and how vulnerable a woman can be if you truly listen to her and then reframe what she said and in a positive, affirming way. And honestly, I'll be honest, I know I'm joking, but really for men as well, and for my non-binary people, again, I'm telling you I'm terrible with the pronouns. Again, I hope I'm not offending anybody. And I want to just remind you guys in the chat, you're going to see that jot form. I want you to click on it and put your name and your email in there. We don't sell that or do anything with it. What we do is put you on a mailing list for talks. Because education, as you know, is super important to us. So here's the last thing, Megan, and I know I'm close to time, but here's the most important thing. So, but what if I don't want to? That's the big one, right? What if I don't want to have sex? I hear you. You can deal with my vaginal dryness. You can deal with my erectile function, but what about low libido or desire? So I want to remind you, intimacy is about connection, honest communication, self-love. Sex is something different. Sex is a byproduct of that intimacy. So intimacy is about your connection with yourself and others, and sex is an act where it's kind of an extension or an expression of that commitment, trust, and cooperation in a partnership. I'm not saying we're all that healthy. That's sort of the ideal, right? I have not always been that healthy, but that ideal is what I want you to keep in mind when I'm talking. Please don't confuse lack of arousal with lack of interest. A lot of people say, oh, I'm just not interested. If you weren't interested, you wouldn't be at this talk right now, and you probably wouldn't bring it up at all, right? Just because you don't feel aroused, like feel sexually stimulated, doesn't mean you're not interested. And ladies, please remember that for our guys, just because a guy doesn't get an erection does not mean he's not interested. That is a very common misconception. Sexual health is your total health, remember, right? So why? Because libido, desire, the drive to have sex is not usually a medical problem. It's not usually organic, even with a cancer diagnosis. It is usually about our psychology. As we know, anxiety and depression comes along with a cancer diagnosis. So that can be a part of it, right? But it has to do with something else. And I'm just going to talk about that last thing right now. But I do want to note, people always ask me, can I take herbs for this? Yes. There are plenty of herbs you can take to increase your desire, but self-reflection and exploration in a therapeutic setting can heal. So contact us for a referral to a therapist. We have in-house therapists. And then on the resources there, you'll see there's a lot of sex therapists in Michigan that specialize in people with a cancer diagnosis. Your insurance covers them, and it's in that resources section. So this is a way that we can think about a cancer diagnosis as a blessing. You know, before you had a diagnosis of cancer, you probably didn't think much about sex, right? Or if you did, it came easily to you, or it was something that was in the background. Now we're talking about it, right? Now we have a challenge. We have a quote unquote disability. So I'm just going to talk about a patient of mine. So this patient is a young lady. She had a very critical father, and so she learned how to be afraid of being a disappointment. She learned not to have her own needs, not to voice her own desires, and that includes her sexual desires. So she's a person who can give pleasure but not receive. Giving, remember, is a strategy for people who are afraid to disappoint others. So when she's in a relationship, she tends to focus on the man in her life and lose herself. How familiar does this sound to a lot of us, right? So here's where I'm talking about, is this a cancer problem, Megan? Is this a cancer problem? No, it's not a cancer problem, right? But she's a cancer patient seeing a sex therapist. So we're going over that. So the sex therapist would ask her about her sexual needs, and she would have a hard time identifying them. She'd have a hard time owning them or even speaking them, let alone telling her partner. She would become very tearful when asked about her needs. And when she knew sex was about to happen, she would have this anticipatory anxiety that a lot of us are familiar with, both men and women, in terms of feeling like she had to perform. That kind of pulled her away from that mindfulness that we're talking about, or the connectedness to herself and to him. So when we have that performance anxiety, when we're anxious and out of that mindful moment, what happens? So we may check out. We might keep our partner at arm's length because it's easier to blame them for what we're afraid of is wrong with us. We may distance ourselves emotionally or become quietly resentful because we don't want them to make it easier on us by reading our minds. The problems that were already there in our partnership might become amplified and become bigger. We might be worried about our medications or difficulty orgasming. We might pull away or avoid sex. We might worry about our body parts and really emphasize those body image issues that have come up. As that's happening, we don't trust what? That we are lovable, desirable, deserving of pleasure, and that we are enough. That is not a cancer problem. That is a human problem. So the thing about sexual intimacy and seeing the right therapist, as well as doing the supportive care strategies and seeing your doctor, is that it gives you an entrance into truly looking at the inner world that you have that's preventing you from having that real connection with people, which is why we live anyways, right? So if we can treat this not as a problem, but as an opportunity to go deeper into how we voice ourselves intimately or sexually, it can help us to really get connected with ourselves in a way that allows us to connect to others. And then living becomes living instead of just being alive. And then we've really cured cancer, right? Therapeutic work is about intimacy with the self. So this patient needed to own that she's not disempowered. There is room for her needs. She needed to find her voice, and that the disease or the diagnosis helped her to come to that place where she was able to resolve all of those issues using sexuality as a gateway to get there. Fair? So our goal is to confront ourselves about how we keep ourselves small. All of us are broken, deformed, cut up in pieces, have lost things. The hard part about cancer and a cancer diagnosis, and I'm not dismissing this or diminishing this, it is brutal. But it's that cancer patients wear it on the outside and not the inside. You are enough. And if you're lucky enough to have the opportunity to be intimate with someone else, and you're a caregiver watching this, let them know that they're all that you want and they are enough. And that can be sometimes all you need to build that intimacy. Okay. So looks like we might have, where are we on time, Megan?
It is 5:10.
Wow, I did it. Any questions that people want to put in the chat? This is a good time to do that, or I will let you guys go. I hope this was super useful for you. This is how you can contact us, by going to our website and clicking on the contact us button, or you can call us. We're really short staffed, so we answer the phone between 1 and 5:30 most days. And also, we're going to post this talk on YouTube. And when we do, I really want you to go through it slowly, take some notes, and take it all seriously. If there's terms that you don't understand, like outer course, for example, let me know. I really want to focus on books. I think books give you a lot more information than websites do. Get off the web and get into these books. But these websites are also very useful. And this website has a Find a Professional tab, so you can find a person who's educated in helping you work through those inner pieces, or you can talk to a therapist with our practice who can either refer you out or get you comfortable with talking about it. And I see all the big ups here, and I appreciate all of that. Thank you. Any questions? I'm just going to kind of flip through these slides slowly to see if anybody has questions, and we'll give it maybe 2 minutes for questions as I go through these slowly. And I see that was helpful. Thank you. And fantastic. You guys can't see what people are saying to me, so I'm just going to make up praise for myself right now. It was wonderful. I loved it. The best talk I ever did.
Dr. It really was wonderful. I've had the privilege of being in quite a few of your talks, so I can honestly say that was amazing. Thank you so much.
I'm glad. I think it's interesting when you do look at the research, there's so much data, but nobody's talking about it, and it's odd that nobody's talking about it. And I will say, I was going to do this talk on debunking nutrition myths. We do a lot of nutrition talks with Gilda's, but one of our therapists mentioned to us, Dr. Feroza mentioned to us, that most of her patients are struggling with sexual dysfunction, and she really feels like there needs to be more community education about it. So that's why we switched the topic. And somebody's asking me, does our practice have resources like literature available? Absolutely. So we have handouts that I've created on exercises for intimacy without intercourse, a reading list, a resource list. And as I mentioned, for all new patients, we talk about it. So it's part of our history. We have the fortune of having a new patient visit that's anywhere from an hour to an hour and a half. So we have the time to really get to know you, and we don't treat you as a parts and pieces person. We see you as a whole person. We're not just getting you to the other side of treatment. We're also making sure that we do all of the pieces that are involved in supportive care that really are in the NCCN guidelines and that are not well addressed by a comprehensive cancer center. And I see a couple people are putting their phone in their email or their email in the chat. I'll go ahead and save those, but you can just click on that jot form. Kasim will post it one more time. If you don't know how to click on it, I will definitely get you into our database. All of our talks are free, or we donate our time to cancer centers. So we do a lot of this. Any other questions about these pieces? So the things I want you to take away from this Our nutrition and natural therapies are essential for recovering and enhancing sexual function. But the driver, the real piece that's important is libido or desire. And that's about self-exploration and therapy. There's a lot of assistance, and I don't want you to be afraid to talk about it with your partner. And we can help you to do that, especially our therapists can help you to do that. So good.
Hey,
Everybody.
thank you so much, Dr. Roy, and I'm sure
Super.
we'll be lucky enough to have you again soon, but I really, really appreciate that. And I think that's about it. So everybody have a wonderful night.
Can I just say one joke? Somebody posted in the chat, can you help me find a partner? Just kidding. Can you help me find a partner? I'm just kidding. I want to just emphasize intimacy is about self-exploration, self-knowledge. Sex is a byproduct of intimacy. So the person who said that, I love your joke and I love your humor, and I want you to self-stimulate and get to know your own body and learn what turns you on and learn how to voice it. Okay? Awesome. Oh, my practice manager is telling me that I didn't stop my share and I had these slides on. I hope everybody can see me now.
There you go. All right, guys. Have a great night.
Thank you.